UNICEF and the Ministry of Health work together to achieve UNICEF outcome of survive and thrive, to improve the health care for the most vulnerable through resilient primary healthcare systems to achieve healthier lives and environment for children.
The pandemic showed us that there is still room for improvement in strengthening the systems, and more investments are required to keep the cold chain safe, to make sure that the vaccines are safe. So for us, and we are doing this in many of the countries in the region, we saw through the COVID that we needed to go back to primary health care and make sure that primary health care keeps at the center of the work that UNICEF does in this region. Being here today is a real pleasure for me because I'm seeing equipment. I will be able to then guarantee, and the ministry will be able to guarantee that the vaccine that we give to each of those kids that come for a vaccine is of the quality that is required.
The COVID-19 pandemic had a negative effect on the vaccination coverage in children. We went from 95% coverage in 2019 to 65% in the year 2020. The vaccination coverage is increasing, but more work is required to reach the minimum of 95% vaccination coverage. We give thanks to the strengthening of the expanded program on immunization through 14 refrigerators for vaccine storage at the national and subnational level. At the national vaccine storage facility, the storage space has been expanded. The exterior walls are protected from the effects of the weather. The exposure of the cold room to excess dust is significantly reduced. Improved cooling system in the training area and cold room, fence and generator shed. We received 100 cold boxes and devices for the vaccine temperature control. One vehicle for greater access to rural communities by the vaccination teams. And to be received in the coming months are 15 ice-line refrigerators and 10 generators for primary healthcare facilities and 3 walk-in coolers for vaccine storage.
This partnership goes from strength to strength, and so we are here to stay, and we want to recommit ourselves to the primary health care in making sure that every child in Belize has the best opportunities to start a life that is healthy, that progresses, that has the stimulation necessary to grow and develop. Then it all starts when a young teenage girl has the access to those health services that will allow her to have a healthy child and transition through life.